So far we have discussed in previous lecture in this class about the chemotherapeutic agent or anti-cancer classification. So we have discussed in detail about what is cancer and what sort of medication are used in cancerous diseases. So and you can watch the previous lecture of this class in which we have classified in detail about the medication of anti-cancerous agents. So in this class we are going to discuss about what is the principle of chemotherapy. So in this video in which we are dealing that cancer is abnormal new cell growth that is uncontrolled and usually fatal. Actually in cancer disease there is a abnormal rapidly cell division, abnormal cell division which are not useful to human body. So now what is the treatment strategies of chemotherapeutic agents? So the main goal of the treatment is that the goal of chemotherapy is to cure long-term disease for survival, and if it's not possible then goal become palliation. So it's mean that first we have to give to cure those cancer disease which are fatal to human body, and if its curement is not possible then we give treatment for palliation purposes. Now the first class among anti-cancerous agent which is alkylating agent. So alkylating agent, its mechanism of action is that alkylating agent exerts their effect by binding covalently and cause alkylation of DNA. That is lethal to tumor cell. They are more toxic to rapidly dividing cells. So when we prescribe to patient alkylating agents, so these alkylating agents form a covalent bond with DNA, and when they form a covalent bond with DNA, so alkylation become lethal to tumor cells, and tumor cells are more susceptible to alkylating agents. So in classification we have discussed a number of medicine. So it include miclorethamine. So miclorethamine, which is alkylating agent, and doctor mostly prescribe it in Hodgkin disease and non-Hodgkin diseases. So the major side effect of alkylating agent is severe bone marrow suppression. Now the second class among anti-cancerous agent which is antimetabolites. So antimetabolites include methotrexate. Its mechanism of action include antimetabolite interfere with normal purine or pyrimidine nucleotide precursors by inhibiting their synthesis or by competing with them in DNA or RNA synthesis. So antimetabolites normally interfere with nucleotides of DNA and RNA, and they become inhibit it. Indication of antimetabolites mostly in acute lymphocytic leukemia. So acute lymphocytic leukemia in which there is abnormal neoplasm cell production, in which bone marrow produce too much lymphocytic cells. And they also prescribed in breast cancer in females and in Burkitt lymphoma, which is actually non-Hodgkin lymphoma of B cells. Antimetabolite must not be prescribed in pregnancy, and its side effects include renal damage, which is actually nephrotoxicity, bone marrow suppression, and seizures. It also includes 6-mercaptopurine. Its mechanism of action up to somewhat same to methotrexate, and its indication in acute lymphocytic leukemia. Other agent among antimetabolite which is 5-fluorouracil, its indication in carcinoma of colon, breast, ovary, pancreas, and stomach. Last agent among antimetabolites which is cytarabine, its indication mostly in acute myelogenous leukemia. So in next video we shall be discussing about other anti-cancerous agent which actually antibiotics and steroid hormone and their antagonists. So please watch the second video of this lecture. Thank you.